Call the meeting to order. Public comment.
I'll kick it off. In the paper, there was a quote, just want to make sure that we got it right. In regards to 911, the quote was, "Now public safety is an issue." Let me back up here. First it was rudeness, and now public safety is an issue. Somebody is going to die. Is that an accurate statement?
Yeah.
For those that don't recall, and I know you'll remember Carl, and I know Ben, I'm not sure about Jeff, over 4 years ago, that was a very similar statement that I made. And it was regards to dispatchers not doing their job, not knowing their job. I went to Tim Krippus to discuss that matter, and I was explicitly told that I need to speak with Nanette because she's in charge of dispatchers. I spoke with her, and I thought we were making some progress. Then when an election takes place, we're still having problems. In fact, that's why the watchdogs got started, was over a dispatcher issue where training had not been complied with for 6 years. Minutes reflect that that was a decision made at that time with the board's knowledge and Nanette's knowledge that there wasn't going to be training, they were going to do it in-house, contrary to IDPH law, or state law. In that process, we have a new sheriff, and I went to Nanette because that's who I was told took care of dispatchers, and at that time I was told it's the sheriff's problem, not mine. So now we have a switch after that election. Politics came into play. The old board, the outgoing board, at that time was Jim Keller and Funkhauser, and I don't remember the others. They made a decision to reappoint all of the board members, and I believe it was for a 4-year term. I don't remember all the details, or 3-year term. They reappoint everybody, and through that process, and I'll just real briefly go through the list of things that we identified, and this is, again, why I got started in this was 911. And these are things that happened under the board's control and Nanette Krippus. They allowed dispatchers to not be trained for 6 years in direct violation of state law. She drew 2 paychecks during the same hours, getting paid out of the sheriff's budget and her 911 budget. Thousands of dollars on gift cards with no record of who got the gift cards. Collecting pay for meetings that she never attended. Purchase of ducks for the duck race at the lake. 911 funds on Christmas parties, and they lied on the claim stating it was planning session, yet there's no minutes for any of those planning sessions. Those were parties that they had. Christmas parties. Even the county board minutes reflected some of those parties. She's had more flat tires than anybody I know, or had Tim take care of those at the shop. I have personally witnessed 911 transactions on the computer being deleted because it was what was on paper was in conflict with what happened at the scene. Gave herself dispatch pay over the union contract workers. She put herself into the position to get those overtime hours versus the other people that did that. She's the only county employee that has a no-bid contract for the position. She's illegally used the credit card month after month when they had a gas card, purchasing gas in excess of what's even capable of going into the vehicle she was driving. Put her family on the cell phone plan. These are just a snapshot of what I uncovered in the first 9 months of doing what I did with the watchdogs. And this is where it all started from. And I read in the paper Carl's quote. Carl, I agree with you. And that's what I said 4 years ago. Now I see that the plan, and I haven't been to the last 2 or 3 meetings. I don't know what the hard plan is. I've talked to Troy a few times on some of this stuff. The plan is to put the dispatchers in control of 911 and put Nanette over those. We've had problems with illegal activities of board members, illegal contracts, illegal loans, things that Merle had done, things that some of these board members needed to go. Some of you folks knew that, but couldn't make that happen before. We took steps to change the law, and there is a clause in the law that allows those changes to be made under 3 conditions: neglect of duty, misconduct, and official misconduct. Official misconduct is a criminal act. Neglect of duty is not doing what the law says you're supposed to do. Those board members who were a party to that are subject to that statute. We were told can't do it because there was nothing in the law that allows you to remove those board members. So we ended up getting the law changed. It passed unanimously in the House and the Senate. That law went into effect January of last year. There's a method to remove some of those board members. I believe the problem lies within the leadership of the board. No offense, Troy. I know you're on the board. We've been through all this, but there's people on that board that need to go. And I also believe that allowing Nanette Krippus to have any control of anybody, let alone employment, is absolutely crazy under the circumstances and the facts that have been presented for years. This problem isn't new. This problem has been there, and this problem is why I got started doing what I'm doing with the watchdogs. That's all I had. Thank you.
Thank you. Any other public comment?
Yes, I'd like to back up what Mr. Allen said. A lot of that stuff that Mr. Allen said is correct. However, a lot of that stuff's in the past. A lot of change, and change is inevitable in a lot of things. We've worked to try to correct a lot of these issues, as Mr. Allen said. You know, he's worked to change some things on the legislation of holding people accountable on the board. But one thing he hasn't worked on is holding public officials accountable. And by allowing these dispatchers to keep reporting to the person that they're reporting to, the certain level of service will never increase. Because although that there are a lot of issues in the past with the 911 and maybe some of those issues that he brought up, a lot of that stuff's been changed, a lot of it has been improved. One of the things that hasn't been improved is public safety, regardless. So whether it's a political statement that was made in the paper by you, Mr. Jennis, about finding somebody to work with the sheriff or replacing him, or whether it's a personal vendetta against somebody, it's not going to fix our issues with public safety. Public safety is the #1 priority, and that comes with the training. And the training of our dispatchers is essential for this county to keep people from dying. And I agree with what Mr. Farnham said. I agree with what you said, Kirk, is somebody's going to die. And this is how important this issue is. And we need to leave politics out of it. We need to leave personal vendettas out of it. And we need to leave the past out of it. And we need to move forward. And I think that we're on the right direction. We gave the facts to the board. We've done a quick fact, and we're having a meeting today at 4 o'clock again for strategic planning for this. It's going to take time. But it will, and it has to be improved, regardless if those dispatchers reporting to the sheriff, whether they're reporting to the county board directly, or the 911 board, or the 911 director. Regardless of who they're reporting to, they need to be properly trained, they need to be held accountable, and everybody in that position needs to be accountable. The 911 director needs to be held accountable by the 911 board. The 911 board can be held accountable by the county board. And just like Mr. Allen said, legislation's changed. You guys can hold us accountable. And I will challenge any of you to do that, to prove those three things with certain board members. But the standard is different for an elected official as the sheriff. And I believe the organization of the dispatchers and being in the position they're at is troubling. Because now we have a 911 director and we have a sheriff and we have two bosses. You cannot have two bosses over any people and hold them accountable. The right hand don't know what the left hand's doing. And as long as there's two bosses, I don't believe, just for your information, Mr. Jennis, that it's going to be right to put Nanette back in that sheriff's office. It's not going to make a difference. And for those of you that don't know, and Mr. Clark will probably back this up, there was a meeting between the sheriff, Mr. Clark, who was then chairman, and the 911 director, and it was very clear from the sheriff that those dispatchers report to him and he will hold them accountable, and the 911 director and Mr. Clark has no control of those dispatchers. That's what the meeting was. That is why Nanette is in the position she's at now and no longer in that jail. So we have to do whatever we got to do to move forward and leave all this stuff out of it. I know it's November or October, the election's coming up, and a lot of this stuff's getting heated up, and a lot of it's being put in the paper or whatever, but statements are being made that look to me from the outside as being personal vendettas as well as political agendas. And again, That's not something we're interested in, not something that I'm interested in at this time, and we will continue to move forward, and I will assure you that as long as I'm the chairman of that board, we will do everything we can to improve the level of public safety, because that's the most important thing at this point. That's all I have.
Thank you. Any other public comment?
Well, I would like to reiterate that the office, correct me if I'm wrong, being moved physically from the sheriff's office to the basement of the courthouse was the call of the 911 director and not the decision of the sheriff. And that was almost immediately after he got elected, and the previous sheriff, whom well, we know, was not working there anymore. So the disconnect, in my opinion, started at that point in time.
Anything else? Thank you. Any other public comment? Item 3 on the list is a presentation by Nicole Shaughnessy on the Edgar County Special Ambulance Service levy.
Good morning.
Morning.
I won't take up but a few minutes of your time. I prepared a short presentation this morning for you because over the last few weeks, the discussions of decreasing our levy have brought about quite a few misconceptions regarding ECSSA and what it would take to operate a business of our caliber. So my purpose today is to provide you with accurate facts and figures that are needed to help you make an informed decision. So we're going to start off, this is our mission statement. The mission of ECSSA is to provide the citizens of Edgar County with the highest quality of care that we can offer. We provide prompt response, professional patient care, safe transport to the facility of the patient's choice if possible. And we've been proudly serving our community since 2003. ECSA currently has 19 employees with a combined experience in EMS of 171 years. Our average length of employment for both our full-time and our PRN, which is also as-needed staff, with ECSSA is 5 years, and that's much more than the national average. 18 of our 19 staff members live in Edgar County, with 17 of the 19 living within our Special Service Area Ambulance Taxing District. Our average paramedic salary is $45,000 a year, and our average EMT basic salary is $30,000 a year. Those are also much above the average, especially for this area. We are one of the best paying services in Central Illinois. We provide more than what is currently required by our county contract. We did this by addition of our third ambulance that we schedule 24 hours a day due to the increased needs of our Special Service Area number 1 district. All 3 staffed ambulances are staffed and licensed at the paramedic level, so there's always a paramedic ambulance available with all 3 of those trucks. We also provide a 4th on-call paramedic ambulance when needed, along with a 5th BLS, or basic life support, staffed with our EMT basics, that can be upgraded to a paramedic level if needed also. We also have and provide an off-road rescue vehicle that is equipped to remove patients from remote locations and assist with search and rescue, and is fully outfitted as a paramedic licensed vehicle also. We have state-of-the-art cardiac monitors on all of our ambulances that have the ability to transmit electrocardiographs or EKGs, which some of this might be kind of foreign to you guys, and that's fine, to the hospitals and physicians from the scene, and laptop computers on every truck with electronic patient records. So we do no patient care reporting. Everything is done electronically. So the minute that we pick that patient up and we put them on that monitor, we can send their heart rhythm. If they're having a heart attack, heart arrhythmia, anything, we can send it directly to the cath lab that we're going to the ER that we're going to. We can even send it to the PDF or handheld mobile device of the cardiologist on call. So if we have someone that's having an acute MI or a massive heart attack, and we're going to take them to Terre Haute, to Union, to the cath lab. We know what physician's on call. We can not only send it to the ER, so the ER physician knows what's going on with that patient before they ever get there. We can also send it to the cardiologist that's going to be taking care of them, that's coming in to take care of that heart cath. We were one of the first, actually we were the first ambulance service in Central Illinois 5 years ago to have this staffed on every single ambulance. When we bought the ambulance service in 2009, we only had one ambulance that was capable of monitoring 12 lead EKGs, and it had absolutely no transmitting capabilities whatsoever. So now every single ambulance we have is outfitted with this, along with our paramedic assist vehicle. Our staff has also been trained specifically to perform blood draws in the field when we start IVs or any other time in the field when we need to. And we did this specifically to help Paris Community Hospital with their efforts to achieve their stroke certification that they've been working towards. So this also helps when we go other hospitals such as Terre Haute Union and Terre Haute Regional Hospital, whose ambulances were already doing that, but the staff had never been trained in this area to do that. We also have a transport ventilator that goes with us. We have two, one at the ambulance and one that's kept at the emergency department, that we use for any of our critical care transports that we perform. So we are able to assist their ventilations controlled with a ventilator, just like they would get in an ICU, while we transport them. Also, I'd like to add that all of our ambulances and our staff are both Illinois and Indiana licensed. We did this specifically last year because of the high number of patients in this county that doctor out of our area, that doctor in Vigo County. They would prefer most of the time to be transported back using their own ambulance service with their own local folks taking care of them. And so it was one additional way that we could better serve our community. So all of our staff is Illinois and Indiana licensed. They have to have that before they can be hired. And along with that, all of our EMT paramedics are all nationally registered. That is not something that the state of Illinois requires, but it is something that ECSSA requires. It is the national standard that all paramedic practices are governed by, even though the state does not specifically follow that. And it just helps demonstrate one additional way that we always put quality patient care first. So again, it's nothing that's required, but it's something that we chose to do. ECSSA provides over 150 hours of community service to our community free of charge for events in our district. We sponsor numerous community organizations, events. We provide CPR, first aid, basic life support courses to our community organizations, businesses, individuals. We do a lot of the training for our larger factories such as NAL, Simonton, Cadillac, where we do all of their first aid training. We do all of their certification for the first responders. We keep up the maintenance on all of the AEDs in this entire community, churches, sheriff's department, all of the factories. We maintain the maintenance on all of those for them to help them. And we also offer yearly EMT basic courses, which is a 22-week-long course taught by our own staff and instructors. And we started this 4 years ago, and in the last 4 years we have graduated over 30 local students, young adults, middle-aged adults, and even some fresh out of high school through our EMT basic program, who are now working in the medical field, many of them in our community, taking care of our own staff, our own community. We have also awarded over $6,000 in scholarships to graduating seniors in Edgar County since 2009 when we purchased the business. Now down to the nuts and bolts. This is where it seems to have where we have the most miscommunication. So we've decided that we would like to provide you with some accurate numbers, what it takes to run our business, not estimates that were provided by anyone else. So these are all numbers that are directly related to our contract requirements. This is not our entire budget. It goes much more and above and beyond this. This is just what is required to fulfill our contract with the county. We have spent $18,000 a year in continuing education for our staff. Over $40,000 a year in fuel. Our workman's comp insurance alone is $53,000 a year. Our liability insurance is over $62,000 a year. And our corporate insurance is over $15,000 a year. So you can see that's well over $100,000 a year just for insurance. Our medical supplies run anywhere from $48,000 to $55,000. The mortgage, and I put in here in parentheses, assumed from the county in January 2013, for some of you who might not have been on the board at that point in time. Many of you will remember last January when the board realized that they had a mortgage with one of the local banks. That is what our building was funded under back in 2003 when the service was created. That should not have been entered into that way. They did it so that we could receive a lower interest rate. And we jumped through all the hoops in about less than 2 weeks by the end of the month so that we could assume that mortgage and take that into our personal names and get it out of the county's name. Now, we have always paid that mortgage.
Question.
Always.
How much longer is that mortgage? How many more years?
That was last year, so we have 9 more years. It was a 10-year mortgage that we assumed into our personal names at that point in time. Now, as I said, we've always paid that. The county never paid that mortgage. It was in the county's name and we always paid it. But we did assume that personally in our own names last January. Office supplies, over $7,500 a year. Payroll is in excess of $685,000 a year. Our postage, $2,500. Repairs and maintenance, $19,000. Property taxes, a little over $8,000, $8,295. Uniform expenses provided for all of our staff, $12,000. Our utilities, $18,000. Vehicle maintenance, $25,000, and vehicle purchases, $40,000. Now, the maintenance and purchases are rough estimates because there's no way we can purchase a new ambulance for $40,000. When we purchase a new ambulance, it costs minimally $135,000, more upwards towards $150,000. So this is what we budget yearly, so that we know what we've got set back. So you can see our total is well over $1 million of annual operating expenses just to fulfill our county contract obligations that we have. None of the other services that we provide. So, we currently receive approximately $319,000 a year from the levied funds from the Edgar County Special Service Area 1 District. We have never requested or been issued in the last 11 years since the corporation was founded an increase in our levied amount, even with the rising cost of operating expenses and the decreasing revenue that is received from medical payments every year. We also see, and this might kind of startle you because it is very, very new right now, or I should say we're very aware of it right now. We see approximately a 35% increase yearly in our write-off and non-payment accounts each year. So those are from any insurance write-offs. These are not including our Medicare, Medicaid write-offs. So this number does not include what Medicare, Medicaid does not pay us on their fee schedule. So these are specific insurance, write-off payments, and non-payments. So a 35% increase every year. Now from last year until this year, the first 3 quarters of this fiscal year alone, we have seen over a 50% increase from our total from last fiscal year of 2013. So we on average see 35%. This year in our first 3 quarters, we've already seen over 50% increase in non-payment and write-offs. And just a little comparison, so we're comparing apples to apples. According to the Clark County, Illinois Treasurer's Office, Marshall Fire Protection District EMS receives over $500,000 a year in tax funding. This came directly from the Treasurer's Office. I would like you to note that that is a paid volunteer service, not a full-time staffed service. So Marshall alone, over $500,000 a year. Clark County EMS, which includes West Union, Martinsville, Casey, and Westfield, receive over $450,000 a year combined in tax funding. They, again, are paid volunteer services, not a full-time staffed service. And that is the end of my presentation. If you guys have any questions, I would be more than happy to answer anything for you that we possibly can. I appreciate you letting us come and provide some accurate facts to help make an informed decision when it comes to the tax levy.
Does anybody have any questions? Mike?
Thank you.
Committee reports. Alan, you want to start?
Just a little bit from the insurance standpoint. November 1 is our health insurance, when that hopefully all be squared away. Everybody's had this month to get things aligned going to. December 1 is typically property and casualty time, and we're in the midst of like a 3-year cycle there to where we'll probably get some reviews here in November about just, are they way out of line, are they okay? If they are, we'll just go on with that. Workman's comp is a completely rebid thing, that's a January 1, so it's like we have health, property casualty, and workman's comp, all right? So that's gonna be January 1, we have to make that by that time. They're getting information right now on that, all these officers working with them, they're, there was something on the paper, with something about the workman's comp advertisement, I can't remember where I said all that. So those are the things as far as insurance, going down the line there. The other part of that is, I believe it's next week, just so you know, there's a interagency big work conference type thing again in Effingham. I went to that last year. That's where we met different people from the Department of Economic, basically, opportunity in the state of Illinois. That's next week. They invite anybody in the county. They basically invite anybody that wants to go to it. Business, industry, education, elected officials, anybody wants to go to that. I plan on being down there again. I feel like we made some good connections there. In conjunction with that, still trying to figure out a little bit of, they're the ones who would work earlier this year when we thought Lions was going to actually curtail business already by this time, and they haven't. People probably don't know or do know that, I mean, but they haven't, so there's still a question about when that's actually gonna happen. I have no idea, but they're still saying it probably is. That's the WIA, that's the other part that we belong to, the Workforce Education Area 23. They would be the ones that would come in and help set up, hopefully, if there's any displaced workers or workers that need retraining. So they're kind of a part of this big super consortium next week. They are part of it, but that's not just their job. So in case you would hear of that, that's not just them. This is a meeting we go to usually quarterly, and they discuss all that. Trying to think if there was, we already took care of the Regional Office of Education, that amendment last month. And we did meet with the new person in our area for the DCEO. Last name is Hanners. He's originally from Casey, Illinois. So we're looking that somebody in our area will kind of know our area. They're going to cover probably about 12 to 14 counties. They cover everything from up around us, clear over to Marion County, which is Salem, down through Richland, Lawrence, Jasper, and all those too. But he's our person that we would talk to directly as far as the state of Illinois. And we took him a little bit on a tour 2 weeks ago, I guess it was now, just kind of took him around the different parts of the city and the county a little bit, just so that they get an idea and what it looked like. We also made sure we took him out north as we're going toward the high school road. Kind of fortunate, actually, as we were going north. We had to wait for 4 cars to get by before we could turn in left on the high school road. That was one thing. So then we went down and just kind of did a quick tour around that area. Came back, and also, when you come back up as you're going east on High School Road toward Route 1, and I'm sure they already know that, and they have no direct say-so over it, but they realize that when you look right there, you can't even see anything but a big green ditch, you know. So I'm hoping as many people at the state level and maybe even federal level that we can see that will be helpful for our community to see that maybe Route 1 is not going to be a super safe place for 600 kids to go in and out of every day. And hopefully our part, on the west part, that's going to alleviate some of that as they're able to go through nice roads on County Highway 13 to get out on the west side. But on the east side, so that's, That's kind of it, kind of went on longer than I thought it would, but that's kind of what's going on.
When was that meeting?
This next week, it's coming up, I think it's on Thursday, I'll look it up, yeah. It is, there we go, 28th. It's called the East Central Illinois Manufacturing Roundtable. It's a super region conference for education and government, and American Manufacturing Association, or Illinois Manufacturing Association is there. It's kind of a neat thing. Those kind of used to be at odds with education, and now they figured out a way that maybe if we all work together, we can have a little better deal. So it's kind of nice.
Anything
I
else?
think that's it. Dan's not here. I can't think of anything else in animal shelter that you wanted to bring up, so I think that's it.
Carl?
I know, was it last week, we had a budget meeting and talked about 911. And I know there were several people that made comments, gave opinions of what we should do and everything. So I guess my question is after that meeting, is there any direction that I need to hear from the county board when we have our meeting this evening as to how we should proceed on 911 at this point? Or just let stand what was said last week, and I'll pass that on to the 911 board.
My questions still stand.
Okay. Same
I
from
mean,
everybody
that's
else?
just me.
Right,
I mean,
right,
I'm just one guy.
right. I think I pretty well understand where everybody's thoughts are on this. But at some point, somebody's gotta do something. You know, I think, we'll see what the 911 board has to say, but I think the two parties involved, we need to get them together, in my opinion, and get this resolved for the safety of the public. You know, not putting any blame on anybody, but just let's get it solved and some way, somehow move on. Improve the situation and move on.
I think my comments were apparently misinterpreted. My comments were not political or not a vendetta. You asked for an opinion,
Right.
and I'm just based on what
Troy said.
Troy said.
Right.
I think particular attention should be paid to how the agreement is written currently that we're operating under.
Right.
And quite frankly, I mean, the sheriff is supposed to be supervising the day-to-day. They need to be trained. We need to set up an atmosphere. And if it's that important, if people are gonna die, we shouldn't be waiting until somebody magically passes their wand and we all agree on something. Carl?
Right. All right, we'll see what comes from the meeting, but I think we need to get something
Yeah,
going.
well, Kirk pointed out that there was problems before, and Troy pointed out there are problems now. We have to solve them. That's just the way it is. And you know, from the sheriff's standpoint, and we have to rely quite a bit on you. Or, we're lucky to have somebody that, from that standpoint, I guess, that's what we need to do.
My interpretation of what the two sheriff's candidates said the other night was that, I think the current sheriff is still leery. I think the other candidate, Jeff Wood, kind of sounds like he said, and please, I'm paraphrasing, that, at first I wasn't so wild about it. I don't know whether I'm wild about it now, but if we're only gonna try it for a year, it's not exactly a ringing endorsement of what we're trying to do.
Right.
But we do need to offer safe dispatching,
Right.
and I know you're dedicated to that.
Right.
My only thing is I would hope we'd look outside the race.
Sure.
And that's what what I was feeling, it kind of comes down to at different times, and that's a human nature thing.
I didn't
It's
mean to
up.
bring the
Yeah,
I just
I know,
mean
but
to
I'm
help the
saying, yeah,
individuals.
and I understand that, that's what I kind of reiterated.
We
Like,
gotta look at
is
the
this a
sheriff.
good deal or not a good deal?
Whoever's
For whoever, I don't care.
Yes.
If I'll give you sides, run for sheriff if I do, you know.
I do.
Is it a good deal? Oh, that hurt, didn't it? You know, I think we have to look, is it a good deal for our citizens?
Right.
And actually, I thought I thought Ed said like, yeah, he's willing to go for that, let's just do it, let's get it started, get it going. And, you know, then, I'm not sure if they've said something different to that later on,
Yeah.
but I'm thinking, you know, if that's the case, you still have to work with what was Troy was saying, it's like, okay, because we can all go forever in the background, where are we gonna go? If it's a good deal, let's go forward with it.
We're
And
in
if
the
it's not a
we're in
good
the
deal,
foreground, because it's our responsibility.
yeah, that's
to
what I'm
have
saying, if it's not a good deal, then,
service.
let's look at that, and like I, you know, told poor old Carl before, yeah, I'm probably gonna lean on him more on this deal than most other people just talking. Cause, you know, you're gonna have some nuts and bolts, but then the other thing, I thought it was already kind of like, okay, we're gonna do this. We're gonna try this. I thought, kind of quote unquote, I hate to say it that way, both sides kind of agreed, this may be the best thing for our county. I don't know that.
Well, I
for a
thought,
fact.
what I'm hearing is Carl has reservations, the sheriff has reservations, and now apparently, according to the paper, the other candidates,
I'm
the
not
sheriff
saying
has
he didn't
reservations.
say he wouldn't.
No, I read it in the paper
All
what he
right.
said,
Well-
but he said he had,
And I'd go along with you there, Ben, but I would say if it is ultimately our job to make
It
sure
is,
that
yes.
I don't care if the current sheriff has a reservation, I don't care if any future sheriffs has reservations, I don't care if 911 has a reservation. If it really is something that's good for our county,
I
then I
agree,
think,
I agree.
then I think we need to look at it. And I don't know what's good for our county in this, that's why I'd lean more for people who've been involved in it. So, anyway, that's my 30 seconds.
In relation to what you guys are saying, and Alan, you just hit on something really important. The best way to keep all the politics out of this, and those, like I said before, you guys know why I started what I'm doing. I've been in emergency services most of my adult life, as I know Eric, and I'm assuming his wife has as well. If you go outside of the box of the board and the sheriff's office and talk to people like Eric and myself and other people that live this business, we've offered input for how many years, Eric?
Since 2009.
We have tried, and I'm telling you, your 911 board is your problem. You folks that were here before know this, because we went through this before Ed ever became the elected sheriff. This problem is absolute refusal to take any input or suggestion from the field of the people that are responding to these dispatchers. And the problem isn't going to fix when you just change this or change that, when you don't have the leadership in place to hold someone accountable. I understand he doesn't want to go in the past, I understand that, but when you don't hold people accountable to past actions, nothing gets fixed. And we've offered a lot of suggestions, and we've hit brick walls, and that's why I took the path legislatively to try to change, give the power to change, because Mark told you guys, for those that weren't around, you can't remove them from the board because the law says you can appoint, doesn't say you can remove. Well, now you can remove them. The law changed, that's been fixed, and therein lies a lot of your problem, in my opinion. That's all, thank you.
Would you be interested in any input?
What do you want to know?
You know what,
Here's
you know-
the thing. I will. I'm not, as an outside provider that's worked outside of this area. One of the big things is training. We have issues with certain dispatchers right now that need more training. Because I can tell you, when we were pulling into here, there was an overturned grain truck on Highway 36, a mile west of Hume, is what was dispatched, or a mile east of Hume, anyway, up on 36.
Uh-huh.
Should Paris Fire Department be dispatched to that run?
No.
Guess who was dispatched to that run? Paris Fire Department. There's a little button that I understand, because I don't know the console, but they click the button, they put in the address, click a button, it tells you who to dispatch. They don't seem to be able to find that button on the screen.
Right.
The other big thing is that the radio communications here are terrible. We've suggested back in 2009, yes, it's going to cost a little bit of money, but put a repeater system up similar to what the sheriff's department has, but on the 911 side. Because if Kirk is in Kansas talking on the radio, I'm hearing Paris talking on the radio, I can't hear him, he can't hear me, and we both try to talk at the same time. So dispatch gets nothing but garbled information. And we've tried to talk, and they're saying, well, Edgar County, it will not work. I said, why won't it work? Edgar County, if you look at a topographical map, that's pretty flat. Now, where I'm from down in southern Indiana, there's big hills, like 1,500-foot drop hills. We have one repeater in the center up on the hill, though, and you can talk, I can be almost in Indianapolis and hit that repeater and talk back to Louisville, Kentucky. But we can't seem to get it to work here. And I brought it when Merle was the president.
Yep.
I've talked to Troy Eads about it, and they just say, well, the way the system's set up right now, it won't work. Okay, I understand that. Then why do we keep putting money into a system that doesn't work? Why don't we get a system that does work?
Because it works everywhere else in the nation, and I train fire departments all over the country. It
And-
works everywhere else.
And I go to Army bases and teach fire classes and other classes, and their radio systems all seem to work, and they have centrally located repeaters. Now, I understand that the digital system that the sheriff's department's on, because we're on it also, there's issues with it because of the way that the FCC works. Because the transmission goes out and then umbrellas out, where the old system, it would be more of an umbrella and you could get scratchy spots, where this, it either works or it doesn't work. Either you hit the repeater or you don't. But there needs to be something done about that would make it better, because if I'm over by Kansas and Kirk's screaming for help and nobody can hear him, you know, he's out there trying to save somebody's life. You know, if I'm close, I'd like to hear him so I can offer up that I'm close. Hey, do you need my help?
Well, and it works, when we had the plane crash, that was a prime example. Nobody could communicate back and forth. I mean, there were multiple agencies, you know, that responded from all over the county to that, and nobody could communicate anything unless we're on the digital channel. So for those who are not on a digital channel, had no means of communication other than a cell phone. You can't be contacting your command chief, you know, with every agency over a cell phone all the time. I mean, it just doesn't work. It breaks the entire system down. It defeats the purpose of having a command center.
And then even with the ice storm that we had, 3 years ago, when we had the ice and it took out the south tower at 5 Mile Hill, dispatch couldn't talk to us. So Brian Gates and I went to 911 and said, hey, here's one of our portable radios. You can contact us on our digital channel. And their answer was, no, we'll just call you by phone.
We took the radios to the dispatch center and said, you may use our radios.
To talk so we can get the information to help the people that needed help. And their answer was, we'll just call you on your cell phone.
So the dispatcher told you no,
Well, that came from, they said they talked to Nanette.
oh, did they? Okay.
But I didn't
Alright.
personally talk to Nanette, but
Alright,
that's what,
yeah.
but the whole thing is there needs to be a new system installed. And and ESDA's been working on a thing to the interoperability. It's just the board needs to give it teeth and do something and say, you know, because it's gonna cost somebody their life if it hasn't already. I mean, we don't know, but
It hasn't helped in some situations.
But
for
you
sure.
know, in the last several months, there's been lots of problems with,
dispatching the wrong agencies to the wrong locations, and they're not doing a good call intake. Because if you say, well, I'm on Route 16 and I've had a wreck, well, depending on where you are, what's 450 ballparks where you cut off and we take over.
Yep.
And then there was a wreck at Conalog Road. You know, it's 5-6 miles away.
right, and that,
Now, are they not trained because they're too new to be, that they
I
haven't
think
been, or
that,
what's?
I don't know the sheriff's policies, and I don't know what his orientation process is. I know what my orientation process is for our employees that we hire, and how many hours they have to do, and what benchmarks they have to be able to do before we will let them go and work on their own. I don't know what his are, and I don't know how 911's training, because they have to go through the, become certified EMD dispatchers. I don't know where all that entails versus what his policies are to make it an effective training course to be able to say, okay, after you've done so much, we feel safe of you answering the calls or working by yourself. I have no knowledge of that information from what they are. I can just tell you from our standpoint, you know, we have a benchmark about how many hours that it's supposed to take, but then we also have the skills that go along with it. And if they haven't done those, then we extend their orientation process till they do complete it. We feel comfortable for them to be by themselves. And I think if you had a direct person over top of dispatch that was there every day, and I'm not saying it's Nanette, I'm not saying it's the sheriff, but you had someone over top of them that's there every day watching them, training them, doing it, it would be the system would work a lot better.
You could see where the
Because,
deficiencies were, you know.
If Nanette was at the,
Well, I'm not saying
You
that,
know,
that
where
that
she
it's,
was.
I'm just saying whoever's in charge of dispatch.
right,
I'm,
sure.
because
I
if
got
you
you.
ask them now, 911 says we're in charge of getting the information in and then spitting it out, that's it. Dispatch is the sheriff's problem. If you look at other counties, like,
Yeah, we have a disagreement on that, and
Right,
as Kirk pointed out, 4 years ago, it wasn't like that, and
but if,
it wasn't the sheriff that changed it, it was,
if you look at other
911.
communication systems like that, and I'll use Southern Indiana because that's what I'm really familiar with the communication, they have a central dispatch. They dispatch police, fire, and EMS all out of one. They have their own supervisor that's over top of it. I mean, I would encourage you all to go out and look at different agencies. And, you know, granted, Indiana's different than Illinois, law-wise. There are great systems out there that you could go look at and say, maybe we ought to try to incorporate the best of this, plus the best of like maybe Coles County or Douglas County, incorporate it and make the best system for everybody. I would encourage you all to go out and do that. And if you need help contacting people, I know I know some of the contacts at the different agencies. I'm sure Kirk does because we cover into Coles County some. We go to Douglas County. We go to Clark County some, to where you can talk to somebody and get a better understanding of what we would need. Do a needs assessment. Does that help?
I don't know what their dispatcher union contract outlines, and I know in my conversation with Troy, he had outlined that he wants to get it out of the union hands so they have more control. And that may sound good on the surface, and I'm not a big union guy, but what will happen, mark my words, they can unionize if they want to. They're gonna go through that process, so they may not be union for a year or two, but you may be hit with that a year or two down the road anyway. We've had, I think, 1 or 2 meetings where the dispatchers came and emergency service came, and we got to communicate face to face with them and explain what we're having as challenges in the field. And shortly after, I think a lot of things did get better.
Yeah.
I know initially when they went through training, we got medical assessment information that was, I mean, it was good. They learned how to do it. We weren't getting any of that before. We've lost some of the experienced dispatchers, and I know everybody's saying, well, it's because of this or that. Well, there's a difference between retiring under SHLEP or retiring under IMRF, and some of them bailed to get a better retirement. You know, talk outside of your core people, your emergency service people, your dispatchers, your cops in other communities, your other ambulances, and I think you're gonna find a consistent message. There's no leadership there. Your 911 needs to have a set of protocols. This is our standard, whether it be a flip chart, A, B, C, D, go right down the line. It doesn't matter who's in charge in that sheriff's office. This is your protocol. You don't follow it, boom. Well, I don't know how that affects union contract. You may or may not be able to, I don't know the whole disciplinary side of that, but you've got some folks that had no business ever being a dispatcher, but they are.
I would encourage you, whatever route you decide to take, to get the input from all of the users of the system, EMS, fire, police, and bring them all in, you know, to sit down at a table together. Because right now, forgive me if I'm mistaken, but there is no EMS representation on the 911 board. And so they have zero input from the biggest user
Right.
of 911, minus the sheriff's department, but true 911 dispatching, the biggest user is not even represented. So they have zero input whatsoever from, you know, for the most output and intake come from.
Because I would almost bet that the majority of the calls for service that the sheriff's dispatch, the answer to 911, are sheriff's calls and then EMS between Kansas, our area, and Chrisman.
Yeah.
Those are the 2 biggest calls, and then fire's probably third.
Yep.
And I would say Paris Fire, because they go out the most, them or the district. But you have very little representation, and when you do go to meetings and discuss things, you fall on deaf ears.
That's an understatement.
And I know one concern in talking with Nanette, that, you know, she's been asked by some different people to get back down there and take over the training of the dispatchers. or be responsible for them. And their concerns are, the number one thing I hear is they don't want to take on that liability of some of the dispatchers. I mean, they're just, that's a big concern. They don't want the liability if they're in charge of them.
You realize they don't have the liability, the county does, don't you?
Right.
The other thing
And we
is,
have it
Well,
right
but
now.
how can they
Well,
truly assess them if they're not in there and she's trying to work with them? She can assess them from afar,
That's
okay?
how she's doing it, right?
But if she's
And
not in
she's
there,
seen the problems that we've had just in the last few months with, it's a repeat of the same people causing the problems. You know, there's certain ones that, you know, they're doing it like they're supposed to, and they've got some experience. It's the least experience that they say have not had the training. You know, one lady, she was with another dispatcher one day and then turned loose. 4 days a week she works by herself. You know, that's the problem.
but we've also.
And they say we don't have any control over it, and they don't. That's totally,
oh, wait a minute.
yeah.
They should be wanting to address that immediately. If there's a problem like that,
They
we shouldn't,
have addressed it.
well, if Nanette was there, she could,
I didn't think she was over there. Or is she? I mean, I
well,
don't
wait a
even.
minute. We just heard, she used to be, but then now she,
I'm talking about now. I thought the sheriff's department was over there. No,
I'll give you an example.
I don't know.
This will give you a good example. We were dispatched to a run that was in Chrisman Fire area, Chrisman ambulance area. We told the dispatcher on the radio, dispatch Chrisman Fire, dispatch Chrisman ambulance. It's in their area. If you want us to, we'll continue. But it was well up in almost Prairie Township, almost to 36, well out of our area.
Mhm.
If you want us to continue, we will. We don't know how busy. We didn't know. And they're like, okay. So they finally dispatched it after arguing with us. So then I called Nanette and said, Nanette, we have an issue. She goes, I'm over the equipment and call intake, and then that's it. The sheriff is over the dispatchers. You need to contact him. That is where the wall is right now.
yes.
And-
We haven't
and I
just
agree.
like that. I mean,
And that's a problem.
And
Mhm.
where that problem stems from, in my opinion, is a board that allows a contract that does not spell out her duties 911 related for those dispatchers. There's no obligation under her contract, and that's a failure of the board and whoever wrote the contract.
And I'm not trying to get into a contest, but
Sure.
I'm just telling you, this is exactly what happened. And so
And it's continuing.
it continues to happen.
Well, look, this one we had up clear at 49 and 36. I mean, we had 3 different agencies responding to that one. You know, and we were the first that got called, and the law says we have to respond. We're going, and we're notifying them on the way that it's not our area, we're en route, but get Paris on the way. Well, they got Oakland on the way. And, I mean, that was an experience in itself, and someone did die, that, not from anything dispatch related, but it was a cardiac, and the person had already passed.
Well,
But
she's been asked by several people, both on the board of 911, et cetera, to go up there, and she's refused. Now, who's actually in charge? Is their contract employee in charge of the board, or is the board in charge of the contract employee? I got a question, and I don't have an answer to that. I'm afraid I know the answer, but
Jeff, I feel your frustration.
I'm still trying to figure out.
Troy told us, what, a month or 2 months ago, she would be there the next day. She would
Well,
be,
that's one issue, and I understand what you guys are talking about there.
Yeah.
I'm still trying to figure out who's in charge of them.
Yeah.
well,
At
that's why.
the sheriff's office, I mean,
Charge of who?
of the dispatchers.
was,
100% sheriff.
Okay,
End of story.
But
Okay,
see,
that's what-
what it's
There's a
supposed to
problem
be
right
is
there. That's it.
the board, the 911 board won't let Nanette be supervised by the sheriff. She used to be.
right,
she
and
still
that's
is
why-
by
and she's-
resolution.
By resolution, she's supposed to be.
that's right.
But they won't let her be supervised.
by whose resolution?
Counties.
Our resolution, county
Do they,
resolution.
so do they
They don't-
hire her from the 911 board perspective? 911 hires her.
Right.
Okay, right?
And only.
Well, yeah, they have.
Yeah, I mean.
I don't know that they have that
I don't,
responsibility.
yeah,
I
we're
don't think they
debating
do. I
on
think we're
whether they
supposed to
have
do
that
it, but-
right.
Oh,
But they did, yes.
all right.
Reading the state
Well, I
law.
can see how this would be really confusing.
Yes, and it needs to be straightened,
It's
it
not,
needs to be
it's not simple. I didn't mean to cut you off.
No,
I
no,
apologize.
But I'm saying like in this case, then, because that's what we talked
The
about
sheriff
before.
should be supervising the 911 coordinator, the 911 coordinator should be supervising the daily, the 911. And if there's something else they're doing, we should have another arrangement with that.
But that's not
Which is
set
how
out
it
at this
works.
point.
That's how it was working.
No, that's the resolution that we're working under now. They just have
They
chosen
don't
not
wanna
to
follow it.
follow it. The 911 board's chosen not to follow the resolution that exists now.
Well, that's what I thought what Ed was saying, is like it was okay with him to go ahead and do this, so long as the sheriff department kept in charge of the protocol. So the protocol would be under the sheriff department, but they wouldn't, quite honestly, have to deal with all the little inner workings. You'd have somebody in charge of all the dispatchers. And so long as they did the
Which is how
protocol.
it is now.
That's the way it's supposed to be.
That's how it is now.
But Carl just told me the sheriff was directly in charge
No.
of the dispatchers,
And
not the 911.
They're employees of the sheriff.
Yeah, he's
Yes.
ultimately responsible.
And they're employees of the sheriff. The 911 coordinator was in charge of them up till she decided she wasn't, I guess, or they decided she wasn't.
But was she in charge of them only because she
Right.
took control of the situation or usurped the power? Or because the
Because-
sheriff always had the power and the sheriff said, you go ahead and do it?
The sheriff always had the power,
Right.
and towards the end of my term, the last year or so, I started giving her a little bit of responsibility. And then when the next administration took over, I think he allowed her to basically
Tim
do
put
it.
her in charge
Put in charge of it all.
Right, okay.
And then when the current administration, there became a clash.
Early.
And they made the decision because of what I was told, the work environment, that she wasn't gonna be down there anymore, and that's when they came to the county board and wanted to know if there was a place to put her in the courthouse. And she was gonna go somewhere.
So Carl, you have a good time with that meeting tonight, okay?
You're pretty clear on our position, right? No, not really.
Well, yeah, but we still gotta get
Yes, we do.
the two together and get it worked out.
I think the employment contract she has needs to be consistent with the resolution that you operate under, because I think right now, you'll find that it's not consistent. She was originally part-time and then went full-time. The original resolution said that position was to be a part-time position. Because hour-wise, there's not a whole lot of work there to be done.
Well, Carl, did you get your question answered?
Okay. And,
It's good, it's good
do you have anything
discussion.
else,
It's good discussion, I like this.
Carl?
No,
I'm just curious, whose responsibility is it to train these people?
This-
Where does that, is that,
Oh, who has,
I mean, you're saying they're
Well-
not qualified, okay, what qualifies them then?
oh, there's actual training that they're supposed to get.
Actually, and it's a great question, and Eric, I know you can appreciate this. Your EMDs are emergency medical dispatchers licensed by the Illinois
Okay.
Department of Public Health.
Okay,
If I, as a EMT, screw up, my ambulance coordinator or my fire trustees aren't the one that take the heat. My license gets revoked. And when these people don't do their job, their license needs to be revoked.
Is that what you were saying, that when Motley took over, none of those were certified
Correct.
by the state of
None of
Illinois?
them were certified, so the first thing he did was send them all to EMD school. They all got certified, and things were a whole lot better for a couple of years. And then we've had some of the retirements, but they are going through that. But the state is the licensing agencies for them, just like a teacher has to have a license from the
They
state.
But-
are the disciplining agency also.
You betcha.
but I will point out that that's a small part of their training. That's the medical dispatch on, like if you get, someone calls in and they're having a heart attack, you can go through the protocol, tell them.
Okay.
But that's part of the problem, but the biggest problem is
knowing the area where.
knowing the area, getting the right people going, and that falls on the sheriff.
Pushing the
And
button,
that's,
pushing that.
Part of it, right?
Right.
Sometimes when you get a cell phone
Now, you said that
call,
falls on the
you maybe
sheriff.
don't, you know, if they're from out of the area, they can't tell you for sure where they're at, but there is a way that they can do it to kind of off the cell towers, get a
Right.
general area. That was the same call that we had out here on 16 the other day, the Conlog situation. It was a cell phone call. And she got pretty close, but you gotta understand where you're at
Right.
and know who, and, you know, just lack of training.
Okay.
Do you have anything? Any of your meetings that you missed?
Hello.
Yes.
Yeah, the assessors, I believe, aren't they, the new supervisor assessment, their,
The
apps are
resumes,
due today.
yeah, the resumes are due today.
We have had one pass, Dina passed. Wanda is taking her test on Thursday again, retaking the test. She called me and wanted to know how we were gonna handle that. She's gonna turn in her app today. I told her.
She already
you know,
has.
Okay. She wanted to know whether we would still accept her application if she was able to pass the test this time. I couldn't speak for everybody. I don't see a problem with it, but I wanted to ask the entire board to make sure that everybody was on board. We'd probably have her test no later than, middle to late part of next week, so
We're not gonna do anything before then. anyway.
that's what I figured, so. Okay, next item is IMRS. We put in a supplemental amount every month now of $8,100. That is gonna fall to $6,300 a month because we're starting to play catch up. Donna and I worked on a little plan to pay some more down of approximately between $50,000 and $75,000, thus saving the 7.5% that we'll propose to you here at the next study session, and then you can decide what you would like to do. When is the next study session, Og? Is it the 10th,
Yes.
Is it in front of the first
It's in
November
front of
meeting?
the first November meeting,
which is the
which is
12th?
the 12th, so yes,
Okay.
10.
Just wanted to make sure. The IMRF contribution and IMRS contributions have, actually the IMRS, which is our law enforcement officers, has gone off 0.61%, but the IMRF has gone down about 0.2%. So it's basically a wash, and the budget has been adjusted to cover that. Let's see, the health department does not wish to raise their levy this year. The mental health, and that was gonna be maybe 20,000, they do not. The mental health folks sent their levy over and they wanna raise theirs 19 too. So it's basically a wash on that levy sheet as far as the amount of money, okay?
What's the public health or mental health, what is it currently? Are they raising it up like 5%?
Less than.
Less than 5%.
Less than 5%.
Less than 5%. You wanna speak to that at all?
No, I'm on that one too. That's another meeting I gotta go to, Carl. No. Yeah, I think there's been some confusion over the last 2 or 3 years on where that's at. They thought they were actually getting more than this, and they were getting the same. Their costs have also increased, so they thought over the last 3 years, I think they were getting 2.1 and 2.1 increase, and they weren't. So now we're gonna try to build that back up to where they actually thought thought they were getting, they're gonna be getting in a couple of years, so.
Then my jackpot question is, what are we gonna do with the ambulance levy? We need to have some kind of I don't know whether the word's consensus, but a comfort level on what we're gonna do so we can put everything together so that we can have it in a timely fashion to pass. We have to pass all this on the 12th. And we're right now the latest we've ever been as far as where this is concerned. So we need to
Pass the levy to lay over on the
right, yeah, we passed the levy so that we can adopt it, or is it adopted so we can pass it?
Pass it, adopt.
One of those two.
Yeah, we have 2 meetings.
So I don't need to be glib about it. We need to decide whether, by the way, if we went for max levy The township equalized assessed values that are covered is 159,872,556. Projecting where we might be, as far as the new equalized assessed value, we figure 162,408,000. And I'll supply this to you if you'd like. So if we applied the 20 cents per hundred, that would be roughly $324,900. And what that will do, it's very hard, we have to go in for dollar amounts. So, you know, hopefully our projections are enough to hit that 20. You know, this year we were a little short. I mean, it's a guessing game. If our levy should fall, the equalized assessed value should fall, that makes it a lot easier. If it should expand more, you know, it's hard to hit the exact mark. So, I leave it up to the discussion or whatever you would like to have me do, or us do.
Last year, what did it receive? What was it, 289 or something like that?
318.
318 was last time?
I gotta find which pile I'm
Yeah, it
in,
was,
guys.
that's the numbers hitting my brain, but I think.
And that was at the 20 cents.
Roughly. Not, it didn't hit the full 20, I don't think, if I remember looking at that.
Because you go with the dollar amount and the assessed value is up high enough that it's less than.
Yeah, it was, oh. I got too many papers here, guys, but it was almost 20 cents. It was just a hair short. They were, I think, short
Well,
$1,200 of the levy.
and part of that is because when you have your equalized assessed valuation, you're somewhat at that, yeah.
Yeah,
So
it's hard to aim.
You're gonna make your money based on what you know you've had in the past.
Right.
Most of the time, I mean, you can do whatever, yeah.
Unless you just go nuts, you
Yeah.
can't do that.
Right.
What do you think?
So are you gonna make a point, Alan?
Well, I was just trying to figure out what it was, because my concern is, one, and I'll say this so everybody knows, I don't think, based on also what our state's attorney has said, I don't think that we can automatically say, just so, my opinion would be, I think, a continuation of his, that it could automatically be that 20 cents. I think that's something that, just like we're discussing 911, I think every year we owe it to our taxpayers on this whole sheet. That's not just you guys, these are like all these sheets, to look at these and say, what is the best thing that we're supposed to do? On this one, this time, I would have a concern changing it, especially on this year, from what you received in the past, at least, because I feel like whenever, bad, good, or indifferent, a discussion on how that all rolled apart, but my opinion is that it should stay that same, or, if it's a cent more on the increase, I don't have too much concern about that. I don't think it should drop any, because I don't think in their forward planning, they would have planned for a drop in the amount of money that they were going to receive. I don't know if that was a point or not, Augie, but that's what I wanted to say.
You made a point.
So,
Carl?
I'm thinking. So 318 last year, and based on the 20 cents this year, it'd be 324.
24.9 is what
Yeah.
we might expect.
And when we had our meetings in the past, we were talking about lowering it. There was discussion about lowering it to 289.
Yeah, 289, that's what,
289.
that's why that hit my head instead of the 318. I hadn't turned around.
They basically got 319 this year.
Right. The first three numbers were the 318, I can remember before.
I'm not sure it should be lowered either this year. Like, I have to agree with you,
It's tough to do that, isn't it? No, just kidding.
but,
You just have to question whether you're right when you
That's
start.
right.
but come next year, I don't know what are we gonna use for just, you know, I guess, how's this year gonna be any different than next year? You know, if we think it needs to be the same this year,
Well, I guess from my standpoint, I would look at that, if I think this is fair and equitable, and I think it is, and of course, I'm looking at that, this is one of my townships, I'll be honest with you.
Mhm.
This is one of my townships, and I tried to figure those seven townships in it, there's everything but the outlying area, you know, and I don't know, and I could have figured wrong on that, but the number of people they have a possibility of serving, even off of like the 2,010 or 12, you know, people in those 7 townships. And I could have done that wrong, but that's only like 6.5 cents a day per person. And I know you can take everything down to those people, and I don't care, just like both these guys are saying on their ambulance service, I don't know that I wanna be that one person on that one time that I didn't say it wasn't worth 7 cents for that day, for that person. And I know you can do that to the nth degree and make no sense, but if I don't think it's way out of line, Carl.
Yeah, I agree.
I don't think it's way
I've got
out of
a
line.
question.
But for the next year, so that on I'm looking at that and I'm saying, like, if next year, on all the rest of the stuff we do in county, and we make a determination that it's our employees deserve a little bit more or a certain percentage more, I'm probably not gonna have a problem with maybe not that full amount, because they have other services that they provide, which I don't feel we have to pay for, quite honestly. And what you guys do that you wanna do is good. I mean, I think we only have to pay them what we have to pay. I mean, if you wanna do all the nice things in the community, I appreciate that as a community member, but that's it. So the next year, yeah, I mean, if we think everybody else is worth 2% or 3% increase, I'm probably not gonna be too averse at giving them that, because I assume their employees and all their expenses went up the same amount, so I'll stop there, okay?
how's the Kansas ambulance funded?
Tax levy.
Specifically for the Kansas ambulance?
Yeah, we have a.
From Kansas Township?
Yep, we have an ambulance levy, a rescue levy, and then the fire district levy.
Okay. Now, Northern Edgar County, is it the same? Do they,
They have some formula that they assess townships, they
Right.
assess the
It's not a
city.
tax.
No tax, they just send them a paper saying, give us this. I don't even know that it's not optional whether they pay it.
Why can't they become part of the process? I mean, now that we know that we have to assess it every year, in June, they become part of the process. We invite you in, we discuss where we're at, and the finance committee looks if they have.
that's what I'm thinking.
We'd be glad to do that.
Yeah.
We've just never been asked.
Right.
We didn't know we had to ask you. I mean,
Right,
until all this
exactly.
is blown up,
We
we didn't know.
you know, we
But I
would glad
mean,
to
we
give
can
you-
say, you can say, you know, things, for example, your 50%, if that stays on track and Obamacare just wrecks everything, we need to understand that. Then we can go to you, the taxpayers, and say, because of what they presented, this is what we're gonna do. It may be max levy, it may be wherever it is, but it'll be some kind of a dialogue that's
All right,
produced.
we'll be glad to come into your, just let us know, and we'll do another presentation, and we'll be glad to share the information, we've just never been
Let's get
asked.
this one done.
Yeah.
Yeah.
I'm sorry.
I wanna find out how you got to 50% write-offs, cause we're about 65 right now.
Okay, my opinion is,
That
leave
part-
it the same as last year, if it's 318,000, and then enter into discussions with them next summer, and we'll assess that. and
Whatever
maybe-
the levy was, is that acceptable to you folks, or were you planning on the growth in the levy this year?
Well,
I'm
we've
asking.
taken a hit 50% on our non-payments, so.
I was curious, why, is that
That's people that we
Medicare,
go.
Medicaid?
No,
No,
that's
okay.
people that we pick up, like say you live
I
at,
didn't know whether they cut their
no,
rates or,
no.
okay.
Oh, Medicare pays roughly 30% of the bill.
Okay.
Medicaid pays 10% of the bill.
Okay.
But the 50%
And
increase,
that 50% does not include those.
I
Those not
understand.
yeah, that's the
That
people
point.
that we go pick up, say you live at, I'm gonna just make up an address, 1703 South Main, that's our building. You live there, we pick you up, we take you to the hospital, you don't pay your bill.
Okay, that's where, and that's
And that's
gone up
increased
from 35
To
to
50%.
Yep.
So half the calls we go on that
Along
they're
with
no
insurance,
pay.
that also includes insurance write-offs, to where some insurances are only paying
X amount for
Medicare
that.
allowable,
Yeah.
such and such, or even less. And
You're
so
trying to
that-
collect them.
And once.
We
once-
try.
Procedures that you-
Yeah, but nobody, I mean, you can't get blood from a turnip, if they don't pay, they don't pay. And then you can't say, we can't have the luxury of saying, oh, you didn't pay us last time, we're not
We're
gonna
not
take you to the
gonna do
hospital today. And that's why the levy's
we
there.
checked our bills.
That's what he said. Kirk, we don't pick up somebody over there.
But no, I mean, that's part of the reason why the levy's
I
there
can
to
see
help
that happen.
offset
I mean,
the cost of
that's
that.
terrible to say, but I can almost see that happening within multi-ranges of ambulance services of like, well, I think that is in your
No,
area over
we
there.
respond,
We know the frequent flyers.
Yeah.
We know the non-payers.
we respond, we do our job, and that's
Right.
partially why there's a tax levy to offset
Right.
the people that don't
The
pay.
ones that don't pay.
But, we're looking at a 50% increase of people that haven't paid this year.
That
Haven't heard from
5,000
you yet. Well, I'm sorry. On the levy.
Well, given the situation that's gone up 15% this year, I don't think you could necessarily give them less. Costs have gone up. I think probably, and if they're willing to stay with what they got last year, it sounds like pretty decent to me. But I think next year, yeah, you need to be in on the conversation ahead of time and rather than just,
What we levied last year was 320. It came in at 318.
okay,
So if we levied 320 this year, they'll get the full 320, if that's what you wanna do. I'm just,
So we levied 320 last year.
yes. And they got 318, $818.
I don't know, we haven't received
Some
the
odd
final
cents.
amounts yet,
Yeah.
so.
Sounds good to me. I agree with that.
I think so.
Do you want to comment since me and you are in that district or?
No, I'm fine with the majority of the board here at this point. I know it's a tough question and we've been through a lot. And we appreciate the presentation. We just, communications.
Have you got enough direction then?
I do. I am going to put the levy at 320 at this point.
And I think Mike expressed that he wanted to leave it the same, or
And Bruner said basically the same thing to me.
that
He would, he might go for a little bit reduction, but he was very strong on their benefits and how they do their jobs.
yeah, I've been contacted by a couple of people, and they are very happy with what they've got, and they don't mind paying more, is what the people told me, because they know they're getting a good level of service from them.
And professionalism.
Yes.
Well, and honestly, if you look at the average median income and what their tax levies are, it's what they pay on their taxes for that is around between $25 and $28. It's
I
not-
looked at mine's $350.
Yeah, but you're a big landowner. I mean, yeah, you got,
Yeah.
you're up there in the hole.
See, we can't all
I said
compare.
median average, Carl.
Okay,
Median average. But, and I, just like for all of you, just like we told Ben a couple weeks ago at our meeting, we used to come to the county board meetings all the time, but we're not per se a
Right.
county board, department head. And so we were more than happy to come, and you're more than welcome to ask us every month.
And I've invited them to come and I would call on them if they had anything.
What's
just
going
like-
on and what's changing, and there's still gonna be a lot of changes ahead with the Obamacare and seeing what comes at the end of the year with the
Which is things that you could enlighten us on maybe sooner than we'll get some other message.
Absolutely.
okay, I have one more thing. And, at the last studies, or at the last committee meeting of finance, I wanted to clarify after I talked to Don, the position, this is right out of the audit book for the last couple years. I'm sorry, I gotta get one more, somehow I messed up. I didn't forget you, Alan, I just.
That's okay.
It shows you the last 3 years of the sheriff's budgets, and it was stated that he was over expended on 2 of the last 3 years. it was, I'm sorry, that's the audit, man.
That's what, the final thing that Don Wiseman gave me.
And he said that the audit's what counts. Okay?
So you don't want that?
No, I mean, that's not what was audited.
Okay.
The audit shows that the sheriff was expended $38,500 less than what he was given last year. And remember, Carl, that the budget was amended in the 2012 fiscal year, which you may not have. Okay, depending on how it was printed out. And I talked to Don about this. Okay, he was $7,644 less than he was given, and then the last year he was 98, or the first year he was 98,000 over. And just for your, the very last page shows you how the previous sheriff ended his term in office. Okay, so I wanted you to see, you can also look at some of the other departments. So I think it's important for you guys to have that, and that's straight out of the audits.
Okay, so what's the difference then between you and, I feel like I'm going on 911 again, between you and Carl on,
I have no
on like
idea what-
2012, where this budget is this, and this is actually how much they spent. It was right here. Where does that correlate to here?
This is what, in 12, or
Right.
if you're looking at
Yeah,
12,
that's what
he
he
spent
spent.
1,900,000,
Right, okay,
1,100,000.
that's what he's got there.
Okay, but see, that is not the amended budget.
But that is the budget.
This is the budget. That is the final budget that was
So when-
approved by the board.
So this was the original budget approved by the board, and this was one approved later on.
Right, that year,
So
for
for some
example,
reason
the
somebody-
reason that we did that was because of the radios, and because we did not include any increases in the negotiations for the sheriff's committee. So the board amended the budget to that, from that, which gave you that final figure of 7644. So the board finally gave him $1,198,400.
Okay, so that's an increase of $70,000.
Right.
So the original budget, though, is like what we're getting ready to do now
Right.
in November.
Right.
And that would have been 1.1 million,
Right.
or 1.12,
1.2,
1.3, whatever.
Right, whatever.
And then, so when did they do this?
Later on in the
Final
year, I
budget.
don't remember exactly when it was done, but it was done later on in the year and approved, and that's audited, and it was approved. There was a layover period.
Yeah, I mean, I'm just curious.
So,
$70,000.
the board did give him $1,189,000, and that should be what the board gave him. And Carl used the figure in the first year, and if you'll notice, originally he was given $892,000. It was increased to $1,074,000, and he still used 89,000 or 98,000 there. So we should still be using the same if you're going to go apples to apples.
The whole thing, I wasn't doing it for political reasons.
But the point is,
The point was that in general, he was spending more in general over the 4 years than what he was allowed in current year, and I was using that so we could partially base our decision-making on this year on that, but
I
it
wouldn't
wasn't
have
for
brought any
political.
of it. But I wouldn't have
From
brought
my
it.
point, was not political.
I wouldn't have brought
Current-
any of this up if you hadn't said that he was over 2 out of his first 3 years, and that's not true.
Well, the figures that Don Wiseman gave me says they are. That's all I go. And you can look at those figures and tell me that's not correct.
That is not correct.
Well, that's,
And Don agrees that's not correct.
well, then
because-
why didn't he tell me that when he gave them to me?
I don't know when he gave them to you, he doesn't even remember. I asked him if he gave you any figures, and he doesn't remember.
He printed it out last week,
I'm just telling you.
he did it himself.
Then he
And we
didn't have
discussed
the
it.
agenda, he didn't have the amendment.
It don't matter
Okay,
at this point. I don't care.
well, I do.
Yeah.
I think we
Well,
should be
that's-
giving the straight information when we're making decisions.
Matter of opinion.
Anything else? The county clerk wants to speak.
Would you be offended or have time for me to give you a very brief report?
Sure.
Just the facts?
Do we still have a point of
Well,
order?
yeah, and bringing that up, what about the $100,000 that you had taken from your funds? I want an answer to that question. When we're talking money,
That was Jim Keller's decision.
no, you weren't.
Do we really wanna get into where the
And
money
we've had
should
more
be
coffee.
getting?
Yeah.
I mean, when
When,
go ahead.
no, I'm not gonna say anything else. I'm not wanting to put you on the spot, but I know that
Yeah.
when we're talking money,
Program election fund, there was an excess of $100,000 in that fund when I was elected. And I, you know, it takes a while to figure out what you have and where you have it.
Mhm.
And there's some money, and there have been fund transfers from that fund to the general fund over the last 3 years, give or take, and now there's nothing in it. And
so was it used for the purpose that it was supposed to be when it's put in the general fund? I mean, was it used?
well, let me answer it this way. When we transfer out 30, 40,000 at a time, I've not incurred those expenses in my office for election. Now,
This was
how,
done by resolution?
yes, how that all,
County board done it?
Yep.
Okay.
so, I mean, how you use
And now you're
that
going,
to,
now you're going to be short.
oh, I'm gonna be short.
And I think we've promised in the past that, because we take money out of other funds, that if there's a shortage,
And we've done that this
we
year already.
make it up.
Yeah, we're gonna fall short, just,
And
equipment is aging, memory cards, repairs, there's just, the publication, requirements are a burden for,
Mhm.
you know, for my budget, and it's for this governor race, it just, you have to publish so much, and, there's just a lot of expenses involved there.
well, if we
And yes,
make a resolution, I'm assuming that you didn't have an opposition to it, or did you?
well,
and if-
when I'm told we're gonna move so much for so much, and what do? And there's 7 people voting on it,
Well, yeah,
I'm not a
but you
voting
need
member.
input.
well,
If you tell us,
I have.
I have.
And I've said that that is to be used primarily, according to the prior chairman, Jim Keller, because I didn't know what it was for. That's for equipment to be replaced.
Oh, I
Use that
understand
to
that.
replace
Mhm.
equipment.
And now you don't have money to replace equipment you need to, is that correct?
That's, well,
Well, then, if that's correct, then we put money in there out of,
but I will also
General
say, I have not been, my budget is my budget, and I've not been told by the finance
guru.
guy that, no, that's too much, you can't have that. He has said, whatever you need, you let me know. And I appreciate that, but at some point in time, projecting out,
There's gonna be a piper to pay.
well, there will be, and the makeup of the board will not be the same.
Right.
I mean, that's a fact, it won't be. And I may or may not be part of it also, but assuming I am, and some of you aren't, then, and I appreciate working with Jeff, but if Jeff's not here,
Right, that's.
then the money's gone.
Yeah, I understand
Well,
that.
like we got income in this year that normally goes into general fund, that didn't go into general fund this year. Okay? And we.
But I've given that back.
Well, but you've also, I mean, you've paid things out of it.
I've paid
I
some
mean,
things
we've
out
been
of it.
flexible.
I
okay.
realize that, I'm just,
I guess
no, go ahead.
my point is, you know, if it's $100,000 is taken and there's nothing written anywhere, well, you know, it's gone, it's spent for whatever, you know, shortfalls in our budget to help supplement that, you know, the intent of the money was for computer equipment, election funds, and like Augie said, if tomorrow, if all of us were gone, no one's gonna know the difference, and he said, well, I want my money, and I said, you know,
Where did that money come from to begin with?
I think there's
I
a
think-
trail.
I think there is a trail that goes back to the federal and state government.
I know he
But
said there
those
were
were
some
one-time
grants.
deals, is
There-
that
yeah,
I
we had
understand.
it.
That's
But
what
could
we
they be
are.
used, could they be used for a variety of things?
Yes, they could legally be.
Used for a lot of things. Yeah.
And I know you've received
Some of them don't
safety
have.
grants, and that money's been taken and not used for safety.
But we have also said at the same time, as soon as he gets ready to use that, he can have it. He hasn't come up, tell him what the picadillos were, and was not that we couldn't spend it, was haggling at the courthouse on who was gonna spend it for what.
But that's not a decision for him to make it. He got the grant for us, and it's the county board's decision
Right.
to decide.
Yeah, it goes into the
Right.
general fund, and we need to purchase that out of the building committee.
Right.
We gotta realize that we've roughly got $22,000 over the last 3 years that need to be used in the courthouse maintenance.
Really? Okay.
Hey Augie, I know where you can get $157,000. Cause you
Not now.
guys get to keep it.
Okay,
Okay, that's,
are you,
I'm done.
you wanna talk some more?
Nope, I'm
All right,
done.
now I want to give some facts. As of this morning, before 8 o'clock, we had 305 early voters on our tabulator, total, and we have 244 absentee ballots still out, awaiting return.
And
Just-
this is.
And this is above average. So I just updating you on where I am.
You don't have any
count-wise.
return there, absentees?
Oh, yes, I
And
have,
they're in that 304?
and they're in that 305 number, but I still have 244
Out.
yet out. So that's just numbers. And this is also important. The legislature requires counties of certain size to be open at certain times on Saturday and Sunday. The bottom line is 100, counties 100,000 and over, they tell when you're gonna be open and at what locations and whatnot on Saturday and Sunday. Doesn't apply to us because we're under 100,000. However, I have chosen to open up on Saturday before the election, which I have done in the past on Saturdays, from 8 to noon, that's November the 1st, on Sunday. This is the new law that for those larger counties, they have to be open. I'm going to voluntarily open the office from 12 noon until 3 p.m. Just so that we can do our part to provide access to the ballot.
Not really, I mean, just keeping more advisory.
That's all I have, Mr. Chairman. Unless you have questions for me, you all know where I'm at, and I think we're off to another meeting.
Airport real quick. We do have the TIPS meeting next Monday. The board also received a report from the chairman who on the conflict or the job application of the airport manager, and that was taken in exec session. They're going to take their findings to the state's attorney and then present them to us. Okay?
So how about the dotting the i's and crossing of the t's now that we're on the airport? What's our latest on that, or is that still?
That's what we'll find out next Monday.
But I'm talking about on
Sorry.
the extensions, or on the airport
Grant.
extension grants.
That's what we'll
Oh,
find
okay, I
out
thought
next
you were
Monday.
talking about, I thought you
I'm
were talking about
sorry.
personnel. I'm sorry.
No,
Okay.
the meeting next Monday is when we meet with the feds.
When you go to Springfield.
Right.
Okay, that's what
I wasn't clear on that.
No, I
And
got you.
so we'll be doing that, and then we'll have a pretty good idea, along with our engineers, and what hoops and what we need to do. And we're very positive, we're gonna be flexible, and we're gonna approach it for what's best for the airport. That's how we're gonna look at it.
Do you know where you meet over there?
Yes, we meet out at the airport.
All right.
Right.
If you're flying in, you can go right up almost to the door.
Well, will you fly me over there?
Yeah. I'll see if I can't get somebody to. If that's,
Airport manager.
there you go.
No.
Anything else coming for this meeting?
All like that.
I move we adjourn.
I could resist that one.
Can I get a second?
Second.
I'm having too much fun.
No discussion. Thank you.
All those in favor of adjourning?
Yeah,
All opposed, same sign. We're adjourned.
Very informative, thank you. That helped me a lot.
Nothing to do with the county.